The advances that have been made in breast cancer research continue to increase, but how do those advances translate to the average American? Here to discuss cancer prevention is Dr. Robert Rice of Maryland Oncology and Hematology. Welcome, Doctor.
Thank you.
Let's talk about some of these advancements that have been made for breast cancer.
Well, in the last 40 years, we've made a lot of advancements. Most importantly is what are the risk factors through various studies that increase women's risk of getting breast cancer, genetic predispositions such as certain gene mutations, specifically BRCA1 and BRCA2, as well as screening, mammographies. We didn't have this about 50 years ago. Now we have means of detecting breast cancer before it can take hold.
How do we reduce the risk of breast cancer? What are the things that we can do as women?
Well, first it's identifying what is your risk for breast cancer, and that means looking at your family history, your personal history, and your environmental exposure. That means talking to a professional who can go over these risk factors and help calculate what is your risk factor. Do you have a genetic predisposition? Women who may have a primary relative, that means mother, daughter, or sister, more than one, who's had breast cancer before the age of 50, menopause I should say specifically, can be at increased risk of having BRCA1 and BRCA2 and should be evaluated by an appropriate person to see if they need testing.
In your professional opinion, why are we seeing more and more women getting breast cancer, developing breast cancer at a younger age, in their 30s, some late 30s? So the screening guidelines say 50, but now they're getting this at a younger and younger age. Why?
Well, as far as why, that's something we're doing research and trying to figure out why. As we noted before, we did find in the last 15, 20 years a gene mutation, BRCA1, BRCA2, that not only can increase your risk of breast cancer, but ovarian cancer, and we think that's one reason. Also, the risk factors for breast cancer are estrogen exposure, age, and genetic predisposition. Now, we talked a little about genetic predisposition. Obviously, the longer you live, the more estrogen you're exposed to. In women, back before the 60s, age of menarche, when you first had your menstrual cycle, was around the age of 16. Now it's 12. So you're living longer and being exposed to estrogen more. So that can be a risk factor. The best way to catch this, we found, is screening, such as mammograms. There are different guidelines. Everyone kind of follows at least one point of agreement. If you reach the age of 50, you should be screened with mammograms. There are different guidelines because these are recommendations. Depending on your personal history and risks, you may need to get mammograms sooner.
And even for those women that don't have a sister that has breast cancer, who has never had breast cancer, or a mother, you should still possibly go get screened, yes?
Oh, definitely.
Earlier than 50.
Definitely. That's the bare minimum of what we recommend. There are definitely other guidelines, such as the National Cancer Center Network, which is the NCCN guidelines, ASCO, which is a big international group of oncologists. We all recommend mammograms actually at the age of 40 and annually.
And what do you think, or what would be your advice that you could tell us or women that are watching that they can do in their daily lives to just stay healthier when it comes to breast cancer?
Well, in general, it's, again, being aware of yourself and your family history. That can be a big factor in determining whether you're at risk. So not only being knowledgeable about yourself, but your family can dramatically improve your screening and therefore decrease your risk of getting breast cancer.
All right, Dr. Rice, thank you so much for joining us today. We appreciate it. Get all your questions answered about cancer detection and prevention by Maryland Oncology Hematology. Contact them at 410-964-2212 or online at mdonc.com.